And hello, this is actually we're not on the radio yet. This is a preface with a YouTube Live and Facebook Live. And today's topic is pain. So until we open up the airways, until the game is over, and I sure hope the teams do well. I wish good luck to both of them.
It was 5-1.
Oh, that's what I hear. Yeah. But, anything can happen, and so anything can happen with the pain. So let's talk about holistic pain, the foundations, the origins, and then, of course, we may repeat it again as we get online.
Well, interestingly, of course, for centuries, people have done things to try to control pain, like cutting off a leg sometimes and that kind of stuff. But in the 1920s, something called cordotomy was developed. And when I was in my neurosurgical residency training, one of the first things that turned me off was a cordotomy. I was an assistant, of course, on the surgery. Went in the operating room, and they opened the spine, fine, took off bone off a couple of layers of spine. And then I saw the surgeon pick up an old single-edge razor blade. And I looked at him. At least it was sterile, I think. And he broke off a piece of it and held it in a thermostat, which is like a little pair of pliers, and he lifted up the spinal cord and put the blade under the cord and cut the front half of the spinal cord. I thought, this is barbarian.
Yes.
And it never changed while I was in training. So when I finished my neurosurgical residency, I was on the faculty at Western Reserve Medical School, but I had research. And for 3 years, I studied pain physiology in cats. And I demonstrated that if we stimulated the skin in a cat with vibration, it would block all input of pain into the head.
Wonderful.
So then I couldn't see how you could use a vibrator on a walking around person very easily.
Or on a cat, for that matter, right?
Yes. And so I decided to try electricity.
Yeah.
And all of a sudden, I could totally block if I stimulated the spinal cord. And about that time, Pat Wall, 1965, came out with something called the gate control of pain, and demonstrated that just as the molecule, the information comes into the spinal cord, you can block it right there in the substantia latinosa. And so I finished my work and I presented it to the National Association of Neurosurgeons. They jumped up on the stage. Right, I was actually in St. Louis, the meeting.
Wow. Yeah.
They jumped up on the stage and grabbed the microphone and said, "You idiot, you can't talk about that. It was in an animal. You don't know what you're talking about." 3 years later, I had done only 6 patients, and every neurosurgeon in the room wanted to do the procedure.
That's how medical world works, doesn't it?
Exactly.
Yeah.
And so my first 2 inventions, dorsal column stimulation or spinal cord stimulation, and TENS or transcutaneous electrical nerve stimulation, are still being used all over the world. And they're good procedures. However, as I developed that in the early days, between, let's say, 1967 and 1970, I was being sent 400 people a year for the procedure. 96% of them had 5 to 7 unsuccessful operations, not 1 or 2, and they were all on Percodan and Valium. I wish to stick a needle in them, let alone a knife to put in a pacemaker, if you will, over the spinal cord. So on October 15th, 1971, I decided somebody's got to find out how to control these people without murdering them or paralyze them.
Yes.
Because even with cordotomy, only 10% were paralyzed, of course.
Only 10%.
And only another 10% had lost the bladder and bowel, and 100% never had another orgasm. But they were so sick, it didn't matter.
Yes.
In my first year, I did what I called an active behavioral modification program. We got them out of bed at 7 o'clock in the morning. They were not allowed to go back to bed until 7 o'clock in the evening. And we kept them busy all day. I sent them to the physical therapy. I sent them to the swimming pool for exercises. And I used the TENS, of course, and vibratorial massage. And in the first year, we had a 75% cure rate of these long-standing pain And that was the beginning, because by that time, actually, by the end of my first year, I had also introduced autogenic training.
So that was the beginning of a biogenics then.
That was the beginning of biogenics.
Right.
And it was the autogenic training was so successful with my patients that I did it to train my brain, but I still couldn't fully understand this concept of total self-regulation. So I went back to get a PhD, but I wouldn't go to a regular PhD program if you paid me in psychology, because I consider it, well, not very good.
You're right.
And so I went to humanistic psychology. And I had fun. For 3 years, I read 350 books, among other things. That's not unusual. I read 50 books most years. And I learned, yes, we can control the blood flow to your one finger, if you like. You control it to your big toe. And that's how biogenics evolved out of autogenic training and the temperature biofeedback controlling.
Oh, of course. So, and what I love about this is it incorporates multiple modalities.
Oh, yes. Interestingly, in addition to cordotomy before that, anesthesiologists often would go in and block nerve various places and then have the spinal nerve. I call it the nerve block cut. And I thought it was crazy.
It is crazy. Yeah.
And it was because it never really did anything good.
But you know, the definition of insanity, Einstein's quote,
is repeating the same thing and expecting a different outcome.
Yes.
At any rate, this was the foundation for me understanding that actually what really happened, as far as I can tell, is when the soul was kicked out of medicine. That was the beginning of technology without spirituality.
And that's been going on for hundreds of years now.
Oh, yes. And so the important thing to me is, of course, being certain there's not something that has to be corrected. If there is, fine, correct it. But most chronic pain is not something that can be physically corrected. There's no surgery that's going to correct it. Now, if there is, fine, take it out. But for pain that is caused by damaged nerves, we're talking about now, then the treatment can be a combination of some kind of electrotherapy and some kind of what I prefer to call retraining of the brain.
And the nervous system.
Well, that is the nervous system.
Well, yes.
The nervous system is totally controlled by the brain.
Yeah.
But anxiety and depression are the things that, of course, continue to make it worse.
Direct, we all often say that anxiety and depression are Siamese twins, but so is pain and anxiety and depression, by the way. Of course. I mean, that's a Siamese twin there as well.
Is there such a thing as a triplet twin?
Probably, possibly, yeah.
At any rate, the important thing is our success rate is about 90% over the last 34,000 people.
And of course, the more modalities that we develop, the greater the arsenal, then, the...
Well, yes. Actually, my second modality that I introduced was photostimulation, the RelaxMate.
Yes.
Because I knew that the brain functions at certain frequencies. And if you have a frequency that's above 30, actually above about 28 into the low 30s, it is anxiety. And so the state of deep relaxation is anywhere from 12 cycles down to 1 cycle per second.
Yes, below alpha.
Yeah.
Or below beta, I should say. Yeah. Alpha and down.
Relaxing.
Theta
is relaxing,
delta.
but delta is true relaxation, getting ready for sleep.
And deep sleep, yes, absolutely.
And so the RelaxMate puts you, it works in 95% of people to put them into relaxation at least. Just, if you have trouble relaxing, just look at these flashing lights at a 1 to 3 cycle per second speed. And of course, then in the mid-70s, also, everybody was bringing me their TENS unit. They wanted my good housekeeping seal of approval. So Liz brought me one, and I tried it. I said, I don't feel anything. he said, you don't have to feel it. I said, it doesn't work. I said, bring me one I can feel and I'll work with it. So he brought me one I could feel. And then I just happened to put it on my head, and I saw flickering lights. And I said, oh, that reminds me of the Russian work with electrosleep. They began actually back in the 50s using certain frequencies on the head to put people to sleep. And interestingly, Saul's device was never any good for pain relief in the body. He originally called it a body stimulator, but later he changed the name to cranial electrical stimulator.
Quite appropriately. I'm glad you didn't put it in your hands. I mean, that would have been terrible.
At any rate, these things are very safe developments in pain management. Now, again, in acute pain, I'm not opposed to using opioids. But in chronic pain, it sucks, and I'm being as kind as I can.
It's, well, when the treatment is worse than the disease or causes more complications, debility and so on and so forth, it's you got to consider the options, really.
Right.
Yeah.
And actually, I personally have never started a patient on a tranquilizer. I have never, in decades, started somebody on an antidepressant drug.
Exactly.
Because not only do you have to work with pain, you have to work with anxiety and depression without making them worse with some stupid drug.
And this is interesting because in the hospital setting, and as my experience as an emergency room and family doctor, family physician, I frequently see as soon as somebody has an injury, heart attack, or physical, the first inclination is to also include an antidepressant because people assume people are going to get depressed. So they preempt it by giving an antidepressant, which then causes you to have brain abnormalities. I mean, it just doesn't make any sense. Well, to some degree, well, go ahead, please.
Well, it takes away anandamide.
Yes.
One of our favorite other chemicals.
We talked about that last show.
Yes.
Yeah, bliss hormone.
Well, antidepressant drugs and opioids both block anandamide, as do tranquilizers. So all of those drugs, well, I don't like them.
Well, that's what the field of holistic medicine is about, because otherwise what do you have? You have medicine, you have drugs, and you have surgery, right?
And you have training.
Training
the brain with some form of biogenics is, in my opinion, at the top of the list. Interestingly, just this morning, I saw a young lady who had been diagnosed as schizophrenic. I understand schizophrenia very well. One of the first patients I ever saw as a medical student was a schizophrenic. This lady is about as non-schizophrenic as anybody. She's saner than any psychiatrist I've ever known. I gave a written statement to that effect.
Yes.
But she responded. She had a severe anxiety attack after her boyfriend died. And I mean, it was a very severe, but so who wouldn't?
It's traumatic.
Yeah. I mean, it's bad enough when a marital partner dies, but when you're that young and someone with whom you're close dies, it's traumatic.
Oh, yeah, absolutely.
At any rate, 2 hours with the cranial PEMF and she was at peace.
Wonderful. And that's electrical normalization. Now, but to truly provide holistic approach, you have to start with lifestyle. I'm just going to put together all the pertinent factors, and when it's time for us to get on the radio, we still haven't started the official broadcast. This is just Facebook Live. No, not just, but it's a Facebook Live, YouTube Live. But I'm glad we have a chance to talk because this is wonderful information, and we may repeat some of these aspects in the course of the show. The holistic approach is everything, and it starts from taking responsibility for your own self. Of course, realizing there's certain factors outside of our control, but letting go of those things that we cannot control. Beginning with a lifestyle, we will talk all about that. Starting with certain supplements, things that your body needs, mechanical modalities, but also active, proactive resetting, retraining of the brain,
Well,
mind, and the central nervous
And
system.
imagine putting
Biogenics.
somebody on a quote antipsychotic drug.
Oh, God.
It caused her to gain 15 pounds in 1 month,
Oh, yes.
upset her menstrual cycle totally,
Mm-hmm.
and they didn't put her on any vitamins.
Gotcha.
So here she is getting no B complex, no vitamin D, no C, no vitamin A. I mean, that to me is insanity on the part of the doctor.
It is insanity, but then again, I'm not excusing them, but they're not trained in what we're talking about.
Well, that's true. I certainly wasn't trained in it.
Yeah.
However,
if you, I'll just say this, what is a true definition of ignorance? And there's a double meaning. I'm gonna have a play on words here. It could be somebody who doesn't know, right? So I could be ignorant to the fact that, let's say, well, something
plane flew by.
right. Especially I'm not paying attention. But let's say I see the plane flying by, but I don't want to acknowledge it.
Exactly.
So it's ignoring the facts. So which one is it?
Well, that sounds like politics to me.
Oh my God, it sure does, actually, doesn't it?
I knew that when I was 16 years of age.
Oh God, yeah.
I remember I was taken to a psychic by my mother to prepare me to go to college.
Mm-hmm.
And the psychic said, well, you'll be well known, but you'll never be president. I said, thank you, God. Because even then, it seemed to me that politicians, if they had any common sense, it lost it when they went into politics.
Well, that's the definition of politician, isn't it?
Exactly. And I haven't changed my mind.
Right.
In 72 further years.
But I will say this, if you want to specify president of what? If we're talking about president of Shealy-Sorin Wellness Institute.
Well, that's different from politics.
That you are.
And of course, there's also a chief executive officer who makes the decisions.
Well, I consult with the president, of course, always. But
the important thing is whether it's a marriage or a work relationship or a business or whatever, common sense is the common commodity.
Indeed. And Rob, are we coming into the radio?
We're coming into the radio.
All right.
And eliminating the hassle by coming
We
to
shall
you.
continue.
Visit tags,
Shall
number
we
2
do the ads
rag.biz.
first?
Yeah.
Okay.
Absolutely.
The views expressed on this show are those of the host, guests, and callers, and not those of radio station KICK, Vision Communications Incorporated, its management or advertisers. Vision Communications Incorporated is not responsible for the validity or accuracy of information presented on this program.
Wellness Wednesday with Dr. Norm Shealy and Dr. Shealy-Sorin. Get the health answers you need from the creator of holistic medicine and the 2020 Holistic Doctor of the Year. To be a part of the show, call 417-447-1777. Wellness Wednesday. Now, here are your hosts, Dr. Norm Shealy and Dr. Shealy-Sorin.
Good afternoon. We're delighted with you. We've been discussing pain and management and the history thereof. But remember, there's so many things in the world that are important. With every patient that I see, at the top of my list is nutrition and vitamins. Once upon a time, I suppose people could be very healthy without anything but homegrown foods.
Mm-hmm.
And until maybe 40 years ago, we could get by without taking huge amounts of vitamins. On the other hand, I grew up with a mother who was taking vitamins when she conceived me. She was a naturalist, a gardener, that kind of thing. And I've never been off a multivitamin and vitamin C.
So foundation even before birth, actually. Yeah.
9 months before birth.
Wonderful.
And I take lots of them today. And all people, in my opinion, because of glyphosate and every other poison in the world, including fluoride, we need probably 10 to 20 times as many of certain things as we did 40 years ago.
Mm-hmm.
That includes vitamin D3. 50,000 units once a week if you weigh 140 pounds or more, or the first, 10th, and 20th of every month if you weigh under 140 pounds. That's at the top of the list for the immune system. Second is B complex. That's 1, 2, 3, 6, and others, but especially those for the brain. Now, once upon a time, it was like 1 to 2.5 of the basic 4. Now, I think you need a minimum 25, and if you're a certain weight, I think you need 50 milligrams of B complex a day.
And sometimes 100.
Oh, of course, yes, definitely.
Yeah.
We used, in fact, even when I was in medical school,
Yes.
if somebody came in with severe alcohol, we gave 100 milligrams of B1 IV.
Thiamine, that's right.
Yes. And of course, you need vitamin C.
Mm.
And again, it used to be you could get by with 100 milligrams. Now I think you need 2,000 to 4,000 days and 1,000 milligrams of MSM. It makes it twice as effective. And for most people, my favorite of vitamin A is a list about this long, but the important vitamin A is astaxanthin. And that can range from 10 to 30 milligrams, depending upon your weight and other things. And it's safe. All of these are safe.
Yes.
Those are at the top of the list. Now, in order to get all that, you can get it, of course, from our website or our web store, but also right here in Springfield, you can get it at Spring Valley. It's a health store I like most. And the reason I like Spring Valley is they serve you. I don't have to look through 5,000 different things to find something.
The service is wonderful.
You walk in the door and they come out and greet you and say, what can I help you with?
Indeed.
Well, I want Ustatushi. They'll find it for me.
Yes.
At any rate, now, of course, they carry all of our goodies, the Shealy-Sorin magnesium lotion, the Shealy-Sorin essential, Shealy-Sorin youth formula, all of the 5 bliss oils. But more importantly, they carry what you need. Spring Valley, the natural foods that I use, and you should too. And of course, let's talk about my favorite food supplement. Nature Blessed Tart Cherries Concentrate. The average person gets only 2.2 servings of fruits and vegetables a day.
Mm-hmm.
You need a minimum of 5. Well, all you got to do is add 2 tablespoons of Nature Blessed Tart Cherry juice, and you now are up to about 6. And it tastes good. It lowers your blood pressure. It lowers your cholesterol. It's anti-inflammatory. And it's available in the produce department at real grocery stores. Nature Blessed Tart Juice, your taste buds and your body will bless you too.
And delicious too.
Of course, that's what I mean by taste buds.
Oh, yeah.
So let's get on with talking about pain.
So I just want to make a statement, or I just want to acknowledge the fact that we normally start on time at around 4:05 or something like that, of that nature, and we go for an hour. But this is an interesting day. Today was the game. What was the final score?
Royals won 6-1.
Royals
6-1.
won 6-1. If you're a Royals fan, congratulations.
Good on.
Yeah. And so basically, we had a really good conversation on YouTube Live and Facebook Live about management of pain, chronic pain, and we didn't even get into acute pain, but we did something really wonderful if you were watching us or if you were with us, talking about the foundations, the origins, how the whole thing started. And interestingly enough, I just want to say that you are actually more well-known around the world in New Zealand and other places are,
Switzerland especially.
Switzerland is a big one. Australia is another big
Yeah.
one. We get a lot of consultations, but not everyone is aware. People don't know that there is actually a world famous neurosurgeon who has, well, I'll let you repeat some of that because again, I think it's worth mentioning again. But if you were on YouTube Live and Facebook Live, please bear with us because we may, say a few things just to kind of reemphasize the point. So the foundations are actually quite magnificent. Up until a certain point, Dr. Shealy was a classically trained neurosurgeon who was classically trained neurosurgical things.
Well, that is true. And it was my training that led me into my life of helping pain. Because when I was in training, which was in neurosurgery, was until 1962. I finished medical school actually in 56. But it took a year of general surgery and then 5 years of neurosurgery. And I was shocked. I mean, literally stunned to see in the operating room, somebody who was taken there to relieve pain, did a laminectomy. They was taking the bone off 2 levels of the spinal cord. And then the surgeon took out an old single-edge razor blade and broke off a piece of it and put it in a little snap that's like a small pair of pliers and cut the front half of the spinal cord. I thought, this has got to be insanity.
Barbaric.
I mean, it only had a 10% paralysis rate, 10% paralysis of the bowel and bladder, 100% loss of orgasm the rest of your life. But 80 to 90% of the time, it did relieve pain for 8 years, if you live that long. But the pain, even after 8 years, returned, even after cutting the front half of the spinal cord on one side. So when I finished medical school, I spent 3 years doing pain research. I was on the faculty and still seeing patients, but all my spare time was in the lab. And I demonstrated that we could control pain totally by stimulating electrically the spinal cord. I also demonstrated that we could stimulate pain with vibration, but I couldn't envision a walk-around vibrator where you needed it. And so I tried electrical stimulation. And so I discovered both TENS, or transcutaneous electrical nerve stimulation, and spinal cord stimulation. Now, I presented that at a national meeting here in St. Louis. That's where the meeting was held that year, and talked about my research. And 3 neurosurgeons jumped on the stage, grabbed my microphone, and said, "You idiot. You don't know what you're talking about. You talk about animals." They wouldn't even publish my article in the Journal of Neurosurgery. It was published in Anesthesia and Analgesia because they turned it down.
Oh, wow.
But 3 years later, when I presented 6 patients that were successfully treated with pain, every neurosurgeon in the room wanted to do the procedure. And it's still widely used all over the world, spinal cord stimulation and transcutaneous lift. In fact, interestingly, TENS units, back when I discovered them through the 70s, used to cost $500.
Wow.
They're now over the counter, no prescription required. You could buy them for $60 on the internet.
And inflation factor as well. I mean, that's just crazy.
Exactly.
Yeah.
But of course, all pain problems are causing all kinds of psychological, emotional problems. When you hurt, it's hard to think straight. And so you get anxious and you get depressed. And in my opinion, among other of the drugs that I consider also slightly worse than barbarian, is tranquilizers and antidepressant drugs. I consider those poison, and you could not pay me any amount of money to prescribe them or take them.
Indeed.
So in 1972, when I discovered autogenic training and started using it in my patients, it was so effective. I mean, my first year of using that, I suddenly was turning people around with nothing but autogenic training. By the end of 3 years, I actually stopped hospitalizing patients for a month and working with totally on an outpatient basis.
With as good or better techniques and,
Exactly.
and outcomes. I mean, that's amazing.
And that's why I, of course, went back to get a PhD in humanistic psychology.
Yeah.
And created biogenics. And biogenics actually started out with autogenic training, but there are now 68 different variations on a theme of different ways you can use your mind to retrain your body and your mind.
And this retraining, resetting is a huge part of dealing with pain.
Oh, yes.
Especially chronic pain, but also lots of other factors, every chronic disease.
Oh, yes.
And that course is available at biogenicscourse.com. And by the way, speaking of the pain management, and we'll get to that in a bit, but I do want to make an announcement that we do have a course that we put everything we have, everything that worth mentioning in pain into a pain management course.
And that's available at holistichealthtraining.com. holistichealthtraining.pain. .com.
Yeah. and
.com. Pain management.
Pain management. Yeah.
But we want to continue talking about how important it is to use common sense training to gain control over pain.
And pain is a huge topic. It can ruin quality of life. It can take away years from,
Function versus non-function, basically.
Exactly. And now this is where I'd like to jump in briefly about the chronic pain and acute pain. And my case is actually quite pertinent here. I'd love to get your perspective on this. I think I've announced this before, but I'm about, on the 17th of March. How many weeks is that now?
3 weeks and 2 days.
3 weeks and 2 days after a spinal fusion surgery. After I've, was a motor vehicle accident, loss of control of the vehicle. Thank God, just me. I mean, I couldn't bear the fact that if I hurt somebody else or something happened with that situation. But the concept is, on the very first post-surgical day, using the same techniques, and we'll talk about the training and we'll talk about the different aspects, but I managed to not even take a narcotic on the very first day. Now, I paid the price on the second and third day because I was walking around more than I should. Again, I knew I was safe. There was no longer instability in the spine. So then I said, if I can walk, I'm going to walk. And then they told me, hey, go sit down. You're going to pay the price later. I did. But so since then, I've learned to kind of adjust and let the body kind of go its natural pace. But I actually already came out to work to the emergency room this past weekend. That's 3 weeks after spinal surgery. And I did all right.
That's amazing because, I've had not quite that big a surgery, but I've had my spine fused twice.
Yeah.
And I learned the first operation I had as an adult, I believe, was an appendectomy. I think I was just barely 19. And I woke up and they gave me a shot before I talked. And the first thing I said the next day, don't give me any more of that. I don't like that crap. And I have always had that reaction after surgery. I will not take Demerol or narcotic. I just don't like what it does to my brain.
And you've got your own personal story about managing pain, and I love the one where you had the sinus surgery without any anesthesia, by the way, and that's part of learning how to manage sensations. And I'll get back to my story after that.
Okay. Well, in 1976, yes, I went to Australia. I went to the Philippines, and on the plane coming home, I developed a sinus infection. Never had one in my life before. It got so bad over a couple of month period that finally, on Thanksgiving, I needed to go to the hospital, but I wouldn't. So I had several drinks of vodka. And the following morning, I called and I said, I got to have surgery. So I went to the hospital. The ENT guy's there, the anesthesiologist there. I said, give me 20 minutes and I'll be ready. So I spent 20 minutes numbing my nose.
Using biogenics techniques.
Using biogenics, one of the ones I discovered back in the early, in the 70s.
And we didn't even have PMF at the time yet.
No, it didn't. Yeah, and it didn't have a TENS unit that would work on the nose. But actually, I learned that if you imagine breathing through the skin of your hand, that's where it started, for about 20 minutes, you can make it numb enough to operate on it. So I spent 20 minutes breathing through this part of my nose and skull, so to speak. And actually, after 20 minutes, I said, okay, go ahead. Now, I heard bone crunching when they went up through my nose. I didn't feel any pain. I didn't feel anything. I could be aware of movement, if you will, but not pain. And the crunching of bone, but no pain whatsoever. And when I woke up, however, I did call my favorite intuitive consultant, Dr. Robert Lightman. I said, Bob, what was I thinking wrong that I got that infection? He said, not everything is from thinking wrong.
Sometimes you get an infection.
Yes. But back in those days, I wanted to be aware that I wanted to be certain that I hadn't done some contribution through it to odd thinking.
Every thought is a prayer, right?
Every thinking is a prayer.
Yeah, positive and negative. So, yeah.
So that's how well you can train your body.
And I'll refer right now because this is an acute process. Now, I did take a few narcotics, pain medications on the second and third day, and then occasionally at night for about another 3 or 4 days. But then I stopped entirely, and I dropped off all the other stuff that was given to me. And the interesting thing is utilizing the information on self-management, retraining, especially what I find useful is some of the exercises such as collect and release. For example, collect the sensations that are happening, by the way, right now in my back, which is, again, I could give it a number, I could give it a pain, but I know there's no damage being done. I know I'm safe. So I'm just collecting that and letting it go. There's a number of other techniques, such as breathing through the skin. I've done that a bit. Expanding your electromagnetic field. That's a powerful one.
That's actually for total body.
Yes.
I learned that in 1972. At any rate, what the guy said was he expand your feet 1 inch and then your whole body, and then 12 inches.
But that was a translation from another language, too.
It would never have occurred to me to think of my body expanding 12 inches.
Yeah.
So I immediately thought of the paintings of Christ and saints,
Mm-hmm.
the aura. I happen to see the human aura around people. There's this around a healthy person. Yours is about 4 inches today. There is something in the air. It's almost like heat waves rising off the body. Now, sometimes it has color in it, but more importantly, it's there as a movement. It's an energy. I think it's the etheric body. I don't know.
I've learned how to, I never considered this up until a certain point to be anything, I knew medicine was science, but everything else was not. But you know what? I've learned to train myself to see that as well.
Good.
It's interesting.
Well, of course.
Yeah.
Now it gets very depressed and dark sometimes in people when they're depressed.
Mm-hmm.
And when they're really psychotic, it may have lightning in it.
Chaotic, all over the place.
Red and yellow lightning shocks in it. But the important thing is the aura that is in that's what it looks like to me in people. And so if you expand the electromagnetic energy field around your body slowly, 1 inch and then 12 inches, that makes the body numb.
Plus, the autogenic training, dealing with anger, guilt, anxiety, depression, dealing with stress, biofeedback on all sorts, mental, emotional, physical. And interestingly enough, what's been happening is I am grateful for the sensations because I know that that's my body healing. So I feel it, and instead of saying, ouch, 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 I'm hurting here, I'm anxious, I'm concerned, I'm just basically basking in the glory of physical body repairing itself right now and giving and letting me know what's happening. And so literally is it sensation? Is it pain technically? Yes, but I'm blessed.
Well, the important thing is you can train yourself.
Right.
And using that, you can heal anything theoretically.
And there's a number, but I think what most people need to understand or become aware is that even though there's a number of painful conditions, and we talk about, there's a course on, there's a holistic pain management course that we took everything that we know, everything, and we put it into that. We talk about a number of various conditions. Now, you can't cover every single condition, but the important ones and the categories. And we also provide a number of ways to understand, apply, and utilize this technique in practical matters, in practical time. And that's so, and I'm grateful that we recorded the course actually, because shortly after, well, I had my personal situation, and I don't recommend having spine surgery after a motor vehicle accident to everybody as a learning tool. Literally, and it's beautiful. It's amazing. Yeah.
Well, the important thing is you can do it,
Mm-hmm.
and it is worth doing. In fact, whatever the problem is, whether it's just anxiety or depression, sadness, but also grief. Let's face it.
Mm-hmm.
During the year following the death of my wife, I used autogenic training every day of that year.
Yeah.
Twice. And I did it on a longer version instead of the 1 or 2 minutes that I can do most of the time. I did a regular version of it because I needed that to clear the strain from my brain.
Gotcha.
And I used, of course, the list cranial stimulator I mentioned earlier also. Those two things got me through the greatest grief of this life.
And then that's just around the time when you came up with the bliss oils.
Well, interestingly, that was the day after my wife died.
So you got a download.
I immediately got a download. I wanted to raise my oxytocin, the bonding nurturing hormone.
Yeah, the feel good stuff.
Instead of using electricity, I suddenly had this, but it'll work just as well with it. And I got the download of which oils to put into it, and it worked.
Wonderful.
Now, I've always felt that was a download from my wife.
Well, that's wonderful.
And I've had other such downloads since then.
Yep. Now we got 2 minutes till the end of the show. Till the end of the informational aspect of the show, and then we'll take calls. Again, this is a very, very unusual week, so we got extra time. So let's just summarize briefly as a concept, and we'll continue talking. The pain. So chronic pain management, holistic pain management is a combination of factors, physical factors. Every thought is a prayer, depending on how a person feels, thinks, positive or negative, what they want to accomplish, and retraining central nervous system, autonomic nervous system, biogenics, but also a number of other factors, lifestyle, approach,
vitamins,
supplements, and there's a lot to it, but we do outline it quite well. And what was that information again?
Holistic Health Training.com, HOLISTICHEALTHTRAINING.com, pain management.
And for those who are interested for themselves or for loved ones, it's a wonderful course that's actually under $50 now on a special because it is so important in this life, in our time. And when we come back, we're going to take every phone call or any question that we have. Plus, during the break, if there's any questions, thoughts, or suggestions, or anything else, we'll be talking. And
about 3 minutes.
3-minute break. What do we got in terms of people asking any or making any statements?
So I have somebody who's asking, they said they're a holistic doctor, and they use Dr. Shealy's cervical disc pump or hydrating pump for their patients, and they were wondering if you could talk about that a little bit.
Talk about what?
Cervical disc pump.
I think
that's isn't that the device?
Posture pump.
Posture pump.
It's actually called a posture pump. It was developed by a chiropractor in Los Angeles, and I did some studies on that and showed remarkable, with a CT of the neck and other parts of the spine. You can put it here or on the lumbar spine.
So radiological confirmation.
Yeah, it's like a big blood pressure cuff that you put under your neck and pump it up, and it will expand the discs. It actually can re-expand the discs, and it's very safe. I often try it on people with neck pain, and it's a great contribution. It is called posture pump, cervical posture pump versus lumbar posture pump.
Okay.
Thank you for mentioning that. That's fantastic.
And somebody was asking about what setting to use on the PEMF device for pain.
We actually have my first study on PEMF for pain was for diabetic neuropathy, and it was 80% successful in people with very severe diabetic neuropathy, not only in relieving the pain, but remarkable recovery of loss of sensation. Now, since then, I've treated it with every imaginable pain from the top of your head to the bottom of your foot. And so locally, it can help all kinds of pain.
And that's setting number one, the sweep mode.
Yeah. The sweep mode is even good for the brain because it actually puts the whole body into its natural, basic resting metabolic state.
And if for any agitation, any anxiety, any stress, any kind of mental and emotional factors, I also would recommend at least 2 hours over the cap, because that's what I've been doing. I use it up to 24/7. I use, when I'm in a position, but at least 2 hours to get my brain in a better place.
And that optimizes anandamide.
And that's setting number 2. And then setting number 3 is sleep mode in Delta. So at night, you can do that, and you still get some of the benefits of the others as well.
We got about 20 seconds till we're back in. But
Any
the
other
final question was shelf life of the bliss oils.
What?
Shelf life of the bliss oils.
So, as far as I know, three or more years. I've got ones I still use.
I got one 4 years ago.
I don't doubt it.
Yeah. It's still good. I mean, but okay, we're gonna say 3 years for basic general.
At least 3 to 4.
Yeah.
From the AirServe Heating and Air Studio. For the service you deserve, call AirServe Heating and Air Conditioning. KICK Springfield. K222CT Springfield.
Now, back to Wellness Wednesday with Dr. Norm Shealy and Dr. Shealy-Sorin.
And now is your turn to ask a question about anything, because it's all related to your health. 417-447-1777.
So till we get a caller, and we'll keep an eye. Rob can tell us perhaps. Well, let's continue on our conversations on now, because here, interestingly, the devil is in the details, so to speak. We can make some general statements, but there's a lot of specifics that for specific types of pain, there's specific conditions. And do we have a caller? Yeah.
Good afternoon. You're on the air.
Well, it's the great Dr. Norman Shealy and Dr. Sorin.
Hello, Bob.
How are you today?
Wonderful.
Hello.
Doing well,
Hey,
sir.
a good friend I sent to you, and we'll just say a doctor. I understand he was all excited. I told him about the coil, the gamma coil. I don't know the exact name.
Gamma
but if you could
PMF.
Yes, if you could make mention to the find audience about that, he was absolutely overwhelmed with it, and he's just loving it. Also, I'm wondering if you have any ideas naturopathically, holistically, how a person can grow back pads in their knees.
Now that's a real good question. Let me just kind of summarize the question, because Bob did a fantastic question here. Has a fantastic question. So the first question is to expand more on the PEMF, because one of our clients, also a physician, has found a tremendous benefit with it. And the second question, just so that we can address that, is what is the best holistic way to regrow, for example, pads on the knees, or let's say so-called irreversible orthopedic type damage, chronic damage. And I can talk about that at some point myself, just a bit.
Well, let's face it. The natural frequency of the body is related to earth frequency. The earth itself resonates at 7.83 cycles or hertz. The PEMF device that we devised sweeps the chakras from 5.83, which is plus or minus 2, that is from 7.83, from 5.83 to 56.8 watts, which is 7 times 7.83 plus 2. And every 10 minutes, it sweeps that. What it does is it realigns the normal resting metabolic state electrically. If you are normal, if you don't have any problem at all, the resting state of the nervous system is minus 70 millivolts of charge. If it gets down to minus 60 or minus 50, it goes crazy. It's hyperactive, all kinds of abnormalities. If it gets down to minus 90, it doesn't work at all. It's dead almost. So what this does is restore that normal electrical charge on the cells. Now, I've been working with this kind of thing since 1961 on what I call the plasticity of the nervous system. If you give the nervous system the right kind of information, it will be retrained. The first research we did was we transferred the nerve from the biceps muscle to the triceps and back and forth, and let the animals walk around with it for 6 months. After 6 months, they acted perfectly normal.
Wonderful.
And
Amazing.
that was my first study of plasticity. In other words, the nervous system can be retrained electrically or mentally.
Mm-hmm.
Wow, that's amazing. One other quick question. I guess from what they tell me, I've been ministering with veterans besides the entertainment business for almost 30 years.
And God bless you.
And
Absolutely. Yeah.
The thing that I'm running into so much, whether it's Afghanistan, clear back to the Vietnam vets, the PTSD thing is overwhelming. I know you've got some things. I will get off, and if you could pass that on, perhaps I could also mention it through Branson and the region around here, because we got tens of thousands of them moving into the Ozarks, and many of them are suffering with PTSD. God bless you all.
Thank you, Bob.
Now, there are two things that are critically important. The PIMP device.
Indeed.
It's the greatest thing in the world for severe anxiety, depression. There's nothing that even comes close to it.
Plus resetting the proper working of the brain.
Yes, exactly.
Literally, yeah.
But also, there is a study in that expanding the electromagnetic energy field, which would put people into a state of detachment and allow their mind to travel in time and space to go back to the beginning of what caused the problem.
And getting to the root cause.
And get to the root cause and then heal that.
Yes.
And that can have almost immediate changes. I mean, within an hour, sometimes people can. Now, sometimes it takes them a few weeks after that, but they immediately know what's happened. They've gotten rid of the horrible stress.
And that is actually a therapy that we do in the office.
Yes.
Now, I do want to address very briefly, because we got a caller, about the regeneration of the joints. There's a way to do so with stem cells. There's a way to do so with exosomes or with PRP, as long as it hasn't gone too far. Because then the other alternative is a joint replacement, and those can be harsh. But a lot more on that. Yeah, we have another.
Good afternoon. You're on the air.
Hi.
Hi, how are you?
I'm fine. I would like, this is Rula, thank you. I'm listening to you here, and I don't know why I'm hearing two different things. Anyway, I would like to know, what is the difference between the BMF gamma coil and the chakra sweep?
Oh, the PEMF gamma coil and the chakra sweep. Okay, that's actually just tomato type of a thing, because initially, before we found out about the gamma, we knew that it does the sweep of the body, that for basically every organ system, really. And then we found out about the gamma, so that's when the name became and the function became updated.
It's the same thing.
Same thing.
Well,
yeah.
Because I have the chakra sweep, and I hear you talking about the BMF gamma. I'm wondering if that's the same thing.
It puts the brain into gamma.
You have the device. That's good.
Yeah, that's the one we did the test on the EEG with. Yes.
Okay. This is I've had it several years, so
that's the same one.
Okay, great. I have another question if there's time.
Okay.
I was diagnosed with osteopenia on my spine. I fell. I had 4 compression fractures from 312 down, and she wants to put me on osteoporosis medicine, and I don't want any. I don't have any osteopenia anywhere else, just my spine, not even osteoporosis. So what do you recommend?
Osteopenia of the spine and compression fractures. And the doctor I'm just going to reframe everything. And the doctor wants to put you on osteoporosis drugs.
Exactly.
Now, personally, I would not take them. I would add, how much do you weigh?
148, I'm 5'7". No, I'm 5'6". I lost an inch with those fractures.
I would take at least 9 milligrams a day of boron.
Boron, okay.
And magnesium lotion.
Okay.
And vitamin D3, 50,000 units, the 1st, 10th, and 20th of every month.
First, 10, and 20th?
Yeah, that's the best way to do it, so every 10 days.
3 times a month, basically.
Okay, great. I'm writing it down, yes.
Now, do you know what vertebrae it is, more or less?
Yes, I do. T12, L1, 2, and 3.
Here is one where I might actually consider trying a posture pump.
Ah, right.
A posture pump is that thing like a big blood pressure cuff that you put under the spine. And where are you?
I am in California, Santa Rosa.
Well, actually, the posture pump comes from Los Angeles, but it's worth thinking about. Look it up on the internet, because I would try it very gently because you could do that for an hour a day. But the most important thing is those supplements.
Okay.
and
What about calcium? Do you recommend calcium at
No,
all?
if you're taking adequate D3, you do not need adequate. You do not need extra calcium.
Because
and
my calcium was low. It was 8.4 when they took it.
Well, if your calcium was low, then I would take maybe 750 milligrams a day.
A day, okay. And for how long?
Oh, the next 60 years.
I hope you live that long. Okay, great. Thank you. And I do have a brace. So how long do you recommend wearing a brace? Because it's already about 7 weeks since I fell.
Gotcha. Yeah, the brace is a good idea for now, and I'm just going to mention one more thing, very easy to do, and quite affordable recently, actually, is a vibration device. It's a vibration plate.
Yes.
Now, if you're having an acute fracture and you're healing now, I wouldn't necessarily recommend doing that. But if you're trying to see, if you want to strengthen the bones and the muscles, and it's a very gentle way of building up and strengthening the bones, the muscles, the joints. And you can get a pretty good workout out of it too. Exercise.
Oh, good.
You talk about it, standing on it.
Standing plate.
Yeah. I give you the cheapest one. It works extremely. It's as good as one that costs 10 times as much.
Oh.
It's called Confidence. CONFIDENCE.
Okay.
It's $249.95 on Amazon.
That's not bad.
I bought one for $2,400 back in 1994, and it wore out 2 years ago, and I bought a Confidence, and it works just as well.
Oh, great. Get them on Amazon or?
Yes.
Okay, great. Well, thank you very much. I appreciate that, because I sure don't want to take osteoporosis medication.
No, I don't like that medication.
Osteopenia was only minus 1.1 anyway, so that's not very bad.
Right.
So.
Go for it.
I'm glad you confirmed that. I appreciate it. Thank you very much.
Thank you for calling.
Yes, ma'am.
Bye-bye.
Well, interestingly, there are many roads to Rome, and all of them are holistic. The only ones I want to take to Rome are holistic.
The ones that are worth taking are holistic. And I do want to say, holistic really means it's a combination. It's everything. It's surgery, medicine, drugs, when I say drugs, I mean, like narcotics and things of that nature. But, if I, after the accident, I want to say, no amount of biogenics would have stabilized that lumbar 3 there. I mean, even though it's powerful stuff, and I used it actually to control the pain before I got to the hospital, but it doesn't solve the underlying problem if it's unstable. So surgeries can be necessary, but so can be medicine, but not in the long term.
Yeah, acute medicine is pretty good.
Yeah.
Acute to me means, now. And to me, if it's not 50% better within 3 months, it's chronic.
Exactly.
If it's 50% better in 3 months, I'd give it up to 6 months before I call it chronic. But it's important that under no circumstance to continue trying some stupid drug after 6 months for sure.
And I want to actually bring out, since we have a little time, but I'll just start the concept. When I was going through the pain and the recovery, especially, it wasn't so much the pain. Again, pain I haven't, it doesn't bother me whatsoever. Well, I acknowledge it. It doesn't. It's not an issue necessarily. But the functional stuff. I mean, I was having so many plans. I was testing for the next level in martial arts, literally, and on the following Tuesday. And so I don't like to have my plans interrupted. That's part of AAA personality, which I'm working on very hard. But there is a certain amount of stress, anxiety, and I would say reactive depressive type of things. And when I realized that I was going through that myself as part of the adjustment process, I mean, I don't want to move like a 2x4 for the next 3 months. I mean, that's not fun. But it's the concept is, you really do have to deal and work with the emotional and mental. And as soon as I acknowledged it, by the way, I got back into the specific biogenics, and I kind of said to myself, hey, enough of the crap, so to speak. We don't have the luxury of doing that. So I just that was the end of that, technically,
Well, the most important thing is thinking.
Every thought is a prayer.
Thinking sets in motion spiritual forces to bring about change in body, mind, emotion, hopes, companions, repair.
Exactly. And this is where the holistic approach comes in, because if a person is only treating physical stuff without emotional and mental, or somebody's treating mental without physical and emotional, that's conventional medicine.
Yes. And again, the single most important thing is how you choose to focus on what happens. I mean, you could get really upset over the 50,000 or more bits of news a day about the variations on a theme, so to speak.
And by the way, it's interesting. I can almost predict the next news wave. I've done that, actually. I can, the next topics, the next, it's basically propaganda at its best. I mean, it
is the biggest propaganda in the history of the world. And it changes day by day.
And it's designed to stress people out, keep them on their toes.
Yeah.
Literally.
Well, you need to detach. Every human being needs to listen to and do autogenic training. Personally, I've been thinking this for years. It ought to be taught in kindergarten. I think if kids learn this, they would learn how to deal with stress and distress and not ever get into serious difficulties.
Well, the best time to learn self-regulation is when you're a child.
Yeah, 5 years old.
That's right.
I saw a 2-year-old today sitting there working a cell phone. 2 years old. He knew how to use a cell phone better than I do because I don't use one.
Oh, yeah.
But they could be trained with autogenic training and learn how to train their brain.
But you see, that's that's the upside of technology too, because we can talk about all the downsides of technology, which is there's millions of it actually, especially big tech now these days. It's just horrendous, really horrendous. But technology can be used for a purpose. Like, for example, when we developed
the Gamma Pimp is technology.
Gamma Pimp is technology. The courses are technology because that's available basically right there online, and you can just do it at your own pace for pain, for bliss oils, by the way, and now for the pain management. And now that it's on special, by the way, what was their website again? It's a natural
holistichealthtraining.com.
Holistic health training.
Holistic with an H.
With an H.com. So anybody who is interested, there is a special, and there is quite a bit of a need for pain management. That's why we're making it available here, and we want as many people to benefit as possible. Really. This is what I discovered when I was going through the pain experience and the injury experience, and I'm doing better than 99% of what would be expected, but that's because of all the factors and modalities. Life in pain, life in discomfort, life in distress is, well, we don't have the luxury of that. Life is just such a beautiful thing. It's a gift. So to enjoy it, to properly live fully, I mean, that's the beauty.
Well, let's face it. You have a strong will to live. That's critical. But you have a strong internal will. And that's to create certain things. In addition to living, you want to accomplish certain things. It doesn't matter as long as you have a goal.
That's right.
And then there's the will of the soul.
And that's the most important one of all.
The connection with God and the divine. That is the will of the soul.
And when a person is aligned there, healing takes place.
Exactly.
When a person is not aligned.
And when a person is in the right state of mind.
Yes.
They can transfer that 1,000 miles away to another person.
And we've done EEG.
We have 216 cases where patients in our clinic in Springfield have had their EEG changed by someone from California or Toronto, some point 1,000 miles away in Canada, or New Jersey. Or you can do it outside the room.
Yes.
I can change your EEG if you're right there in the room next door.
And I just want to say one other thing, and this is on the same topic, but a little bit off, on a tangent. The love of people who are friends and family, because I'm just going to say this. The other thing about my situation that is absolutely fantastic, and I love this, is that I have a loving family. I have an amazing medical partner and a friend and a brother. And I've got basically between my wife, my mom, my family, my friends, I am basked in love. I'm literally, and during this recovery period, it's not just physical. And that may be the reason why I'm doing so well, because if a person is going under social circumstances, or then they're not supported, or there's all sorts of other nonsense going on, healing can be difficult. So I want to acknowledge and I want to thank my family, my wife, my mom, my family, my friends, and just everyone around who has been sending me love and basically just just healing intention, because that factor. And I'm realizing that if I was by myself alone, just without a purpose, without a context, it wouldn't be the same.
Of course not. And I happen to know his wife and his mother, and they're great people, by the way.
Oh, yeah.
One is very fortunate to have that kind of thing. It's really important. In fact, actually, the big study on longevity that was finished in 2011 demonstrated that both conscientiousness, which means being personally self-organized, but a network of friends was equally important for longevity. I don't know how big a network has to be. From my point of view, it should be 3 or more, but even one is valuable. But a network of friends is critically important. And so bask in your friends.
Yes.
Enjoy your friends. Keep that network of close connectedness with family and friends. And, again, in my family, I've got, one wonderful son and grandkids, but my daughter is the closest.
Oh, yeah. You're well taken care of. Let's put it.
Oh, yes. I just have to say she's terrific. And we craved having a daughter. When my wife and I had 2 boys, we wanted a daughter because we knew we needed one. And we lucked out and got her.
Oh, yeah. You did well. You did real well.
But the important thing is honor them and honor your parents. If they, you wouldn't be here without them.
Indeed.
It's so important. I often say I didn't have the courage to choose abusive parents. That was one of my favorite statements, because my mother was over-nurturing, and I'd rather be over-nurtured than under-nurtured.
But for all those folks who have not had such an experience, reset, retrain your brain, do it holistically, focus on your mind, body, and spirit. And that's what it's all about. Because just because you came into the world with a certain challenge or difficulty, it just makes you that much stronger when you overcome that.
Exactly.
And that's a blessing. That's a blessing.
Train the brain.
Yeah.
The whole basic foundation of life and survival and accomplishment is training your brain.
And that includes pain management. And
holistichealthtraining.com.
Beautiful. Well, we're almost, I don't think we can say we have enough time for any callers, for anything more call. But we got a few minutes or less than that? A little over a minute. So now, Dr. Shealy.
If you have questions,
yeah,
and we haven't answered them for you, send me an email, norm@normshealy.com. I'm happy to answer your emails about that.
Indeed.
And if you need us at the clinic, call 417-351-5221. We are here to help you. The purpose in life is to help other people.
And to be of service.
That is helping other people.
And I'm just going to say one more thing. We have less than a minute. What I realized in that accident, it was a terrible accident. It was a very clear understanding is that if I don't take care of myself, if I'm not, I got to be alive. I got to be well. I got to be functioning in order to help anybody else. And that was a big one for me, because that's, it just is,
The time has come, the warrior said, to wait until next week.
And we'll see you again.
Have a good one.
And I think we had a wonderful show. We had a brief introduction, not brief, maybe about 20 minutes, 30 minutes before the show on Facebook Live. Anything else left to say about anything on life?
No, I don't think so. I'm happy. Oh, are there other questions that we should be answering?
There's only one other one that came up, and that was Linda was asking, she said her husband has a strange taste in his mouth. Enough that it's been bothering him that he needs to go to the doctor for it. She said it's bitter and maybe metallic, and was wondering why he might have that taste in his mouth.
Well, first of all, has he been drinking out of an aluminum can?
say, I don't know.
I would have to ask if he has been drinking out of aluminum can. That could cause it. Does he have any silver, so-called, because they're 50 to 60% mercury fillings in his mouth? So if he does, they need to come out.
Or another factor of heavy metal poisoning or some other factor.
That's a
So,
possibility.
and there's a testing for that, by the way. So if you have Linda, I'm not sure where you are in the world, but location wise, but if you're interested, find a holistic provider, or basically, we're available by telephone. We're available otherwise, and we'd like to advise you further. But it's not an emergency room type of a visit. Let's put it that way. And most primary care will probably not know what to do with this. But if you go to a really holistic provider, you'll be able to get some guidance.
And a hair analysis, by the way, is the best for metal poisoning.
That's the best testing. Yeah, indeed.
Much better than blood.
Anybody else out there? Or
That's all we have for today.
Okay.
Then that's where we are.
Thank you.